The following is a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal, too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super, Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD. New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good evening. We hope you're all fine and doing well and having a good weekend. We're here with Noah and Ed in the studio. They are running this show, they're running the station, and they are fantastic. If you want to give them a test, we are live. If you want to call us up and ask questions, you can. It's 1-800-321-0710, the WOR studio with Noah and Ed running the whole place tonight. I just wanted to comment, Christine Marks in the news talked about how the American government is reassuring everyone that Ebola is not going to be a big deal here. But in this weekend's Wall Street Journal, which I just read part of a few minutes before the show started, it was interesting. One of the points that the Wall Street Journal made was that right now in America, and I've talked about it on the show in the past about infections that occur within the hospital. There's almost 1 million Americans who go in the hospital for one reason, and they end up with a significant infection related to the hospital stay. There's many reasons for that. One, of course, is that you've got super bacteria running around when you give a lot of antibiotics to patients. You create super bacteria and super infections, so there's super infections in hospitals. Last week I commented that 3/4 of the hospitals in the United States don't adhere to guidelines for antibiotic use by cutting the amount of antibiotics given to patients when they've identified the bacteria causing the infection. So 3/4 of the hospitals in America over-administer antibiotics. So what percent of patients are dying because of poor or no hand washing of staff? When the staff in the hospital, whether it's the nurses, the techs, the doctors, they go from one patient to the next patient and they don't wash their hands. How many patients in America die from lack of hand washing today, before Ebola? And we know that Ebola was only transferred by direct transfer. It's not transferred by breathing or being in the same room. No, it's like urine or feces or vomit. It's directly transferred from the patient to the staff. Well, right now in America, there's 99,000 Americans who die because staff in hospitals don't wash the hands. They don't wash their own hands. So it's not very reassuring that we can take care of Ebola so perfectly when we can't even take care of infections today perfectly. So, of course, the government wants to reassure all of us, but but it may be the most reassuring thing, if you can, to stay out of the hospital. And I know it's a recurring theme of this show, and I believe that. Our work is all outpatient. We've shown you data, for example, with prostate cancer, where you have better data, more likely to be cancer-free if you come to us. So you go to one of the biggest cancer hospitals around, for example, and you have the chief there operating, not number 2 man or 3 man or the residents or the interns or the students, the number 1 man in New York City. For PSA 4 to 10, he and his cancer center have a 76% chance of success at 5 years. Now, this is removing the whole prostate. If you have prostate cancer with a PSA 4 to 10, he is 76%. We're at 90%, 18% better. Well, what's 18%? Well, there's 250,000 men a year. 250,000 men have prostate cancer. Let's just say there's an 18% difference. If all of them went to him versus all of them went to us, you're talking about 40,000 lives saved. And if you're talking about PSA 10 to 20, having surgery by the chief at this big cancer hospital, his success rate is, and this is all published data, you can go look at it yourself, or you can get our booklet and look at it. His success rate is 69%. Ours is 86%, or 25% better. Wow. Well, 25% better of 250,000, you're talking about more than 60,000 lives saved. And if you look at the PSA 20 to 50, and we have patients with PSA 20 to 50, even higher sometimes, and that doctor removes the whole prostate. Now, people are led to believe if you remove the whole prostate, you're home free, right? Well, the answer is only 44% of the patients are cancer-free 5 years after surgery, versus with us, 73%, which is 66% better. So in every category, our results, from the lowest PSA to up to the highest that he reports, in every category, our results are better. So, for example, prostate cancer, there's no reason to be in a hospital. And there's many other examples I can give you, from lung cancer to meningiomas to acoustic neuromas, breast cancer, lung cancer, pancreas, liver. So it might be best to stay out of the hospital if you can, knowing that infections are a serious risk. I think up till this time, Americans have kind of poo-pooed infections being harmful in the hospital. But in fact, infections are risky business, affecting more than 750,000 Americans who go to the hospital without an infection. And with 99,000, according to Wall Street Journal, this weekend's paper, you can get it yourself, look at it yourself, 99,000 Americans dying in hospitals because the staff are not washing their hands. So the bottom line is there are answers, there's choices. That's why our phone number at our Cancer Treatment Center is 212-CHOICES. If you want to stay out of the hospital, you're welcome to give us a call and learn about the choices of outpatient, non-invasive, no cutting, no bleeding treatment. I'm not talking about every cancer, but I'm talking about most cancers. So you're welcome to give us a call. We have a booklet DVD. We're happy to send it to you. Just call our office Monday through Friday, 9 to 5, and make sure it's in the mail to you. If you're in the area, we're right by Times Square. There's 50 million people who visit Times Square every weekend and every week, every year. And in fact, several people called today. They want all the booklets. They want the brain, the body, the prostate, the DVD. We now have a new MP3 with 70 of our top radio shows. You can come in and pick it up yourself. So just come in, pick up, choose what you want. You want it for your friends, pick up an extra copy. You want it for yourself. You can't sleep at night, just put that MP3 on, and you can listen to 70 shows of Dr. Lederman talking about cancer. And I guarantee you, by the end of the 70th show, you will be asleep. If not, your money will be refunded. And remember, these are all free. So let's go to the good news department. I want to talk about a patient. This is a woman, black woman from the islands. And I'd say that because, again, the black community has twice the mortality rate of white community for breast cancer. This woman came to us with stage 4 cancer, and many of you know you often go to chemo doctors and they say, oh, you have stage 4, it's in the bloodstream, you need to have chemo, or you're going to die. Well, this woman is fragile. She's about 75. She has sons who are doctors. They know all the options. They investigated radiosurgery, and about 2 years ago, they brought her to us. And she had about 4 spots in the breast, the lung, lymph node, another spot. And she didn't want chemo. She didn't want surgery. She wanted, after she learned about all the options, focused beam radiation, just hit the cancer and leave her alone. And that's what we did. We hit the cancer in the breast, the lymph node, the bone, left her alone. She just got new scanning done. This is now about her 3rd sequence of PET scans and workup, which we do usually every 3 months. So after we do a treatment, we give ourselves and the patient a report card. It's independently evaluated, not by us, by radiologists, board-certified radiologists. And she's in complete remission. She's in complete remission. Complete remission means the cancer is gone. The cancer is gone. There's no new spots. We haven't treated her in almost a year. Cancer's been obliterated, even though it's stage 4, without chemotherapy, without hormonal therapy, without surgery, without going to a hospital. Yeah, she got treated with us at Radiosurgery New York, our new freestanding cancer treatment center in the heart of New York City, 1384 Broadway and 38th Street. She is happy, and even more so her sons, who are physicians, who know what she was up against, are ecstatic. We have another patient I want to talk about who came in, 74-year-old man, married with 5 children and 11 grandchildren. He came with his wife for a Gleason 7 PSA 7.93 prostate cancer. He started hormonal therapy elsewhere. Now, 12 out of the 12 cores were positive. Usually when the urologist does a biopsy, they do about 12 biopsies at the same time of the prostate. Well, all 12 were positive. Well, he looked at our data for Gleason 7 cancer, and again, it's in that book I referred to a few minutes ago. Our data for Gleason 7 is 90% cancer-free survival. If you look at the surgeon, the famous surgeon, he's at about 60%, and others are about 60%. So the beauty for this man is, instead of having 60% chance of success, he's with us, 90% chance. Most likely he's going to be cancer-free, and most likely at 74 he's going to live the same as any other 74-year-old man will live, which is probably another 15, 20 years, which is great for the good news department. We're going to stop for just a moment. There's some voices that want to talk to you about the work that we do. My name is Dr. Lederman from Radiosurgery New York. We're an independent cancer treatment center. We work for you, not the drug companies, not the surgeons. No, we work for you. We take Medicare, Medicaid, and most insurances. We answer your questions. We're available. We give you our phone number. You can talk to us, not a machine, like a real human being should be. That's how medicine should be. And we wash our hands.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD called 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman. 212 choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon